In today's episode, we are chiropractors and we are going to myth bust and debunk chiropractic bullshit. We're going to talk about our experience in school, why we stopped adjusting, why we don't do hands-on treatment anymore, and what we do instead. And as always, it's going to be super evidence-based. So strap in. I'm joined today by Dr. Blake Loxerkamp, who was a classmate of mine when we were in school. And he helped me to redesign our Beyond Back Pain program and is really critical behind the scenes. So we're going to get into it and talk about all of our experience in school and in clinic and why we went towards online. And again, we are chiropractors, and this episode is going to be very much myth busting chiropractic in general. So let's just get started by talking a little bit about, school and all that kind of stuff. So Blake, what's up,
Yeah.
man? Thanks for joining us
Hey.
today.
Yeah. Happy to. It'd be fun to chat.
Yeah, well, especially so we've been friends since school, right? We went to Northwestern Health Sciences University together, and I'm curious, like, what was your experience in school? Did you come into chiropractic school already knowing that some of it was utter and complete nonsense, or did you figure that out along the
Yeah.
way?
No, I figured that out along the way, and it was a stressful experience for a little bit to figure that out along the way.
Y-
Because I'm from a small town, and there's a couple of chiropractors in town. If your back kind of hurts, you go in. They usually have a big enough patient base where they don't really need to like do scammy like sales tactics. Just like I'm gonna come in once a month for my insurance, pretty chill. So
Mhm.
I had no idea about any of the like bullshit with chiropractic.
What
Um,
what was your first like tip off in school that you started being like, what's going on here, guys?
I don't know the order of these things, but the things that pop in my head is I went one time to I think it was it Amped?
Oh,
Like a marketing, and it was like all they talked about is like kind of just sketchy sales tactics.
yeah,
So I was like, well, that's kind of weird. I don't like that.
yeah.
And then honestly, the big reoccurring one was how defensive professors got about like, if you were like, hey, this research article like contradicts that, and they were just weird about it. There
Yeah,
were a couple that were really good and whatnot, but on the whole, it was weird.
yeah,
And then I started diving into like research, and barbell medicine was a
sure.
big one where they were pointing out all this stuff, and I was like, oh shit, like
Yeah.
all the stuff I've learned in these first couple of, not all of it, but like everything other than basic sciences is like not super evidence based. So
Yeah. Yeah. Yeah,
yeah.
that's crazy. I mean, the amount of times that we were in school, and I mean, me in school, I was very obnoxious about, not just bringing stuff to teachers after class, but in the middle of, classes, just raising my hand and being like,
Yeah.
"So hold up, because you just said, whatever subluxations, blah blah blah." But I just read a study that says that. Like, for example, we're talking about vector, right? We're talking about, well, in order to move the bones in the spine, you have to apply
Yeah.
force at a particular angle.
Yeah.
And I was like, well, hold up, though, because there was a study, interestingly, this was actually a McGill study, but I think the title is something like the thoracolumbar fascia is frictionless, something, something, something. And basically, you cannot transfer force at an angle through the interface between the skin and the underlying tissue because there
Yeah.
is no friction that's transferred. Therefore, the only angle that force transmits through the skin to the underlying tissue is, basically straight up and down, right?
Right.
It can't go at an angle. And so it was stuff like that where you're like, well, hold up, that's not right. And then you realize like all of our board exams are geared towards knowing that stuff. Well, if you have a right rotated blah, blah, blah,
Yeah.
this bone is right rotated and left laterally flexed or whatever, then at what angle are you going to apply the force? Oh, it's going to be anterior or, posterior to anterior and lateral to
Can
medial. right?
I'm getting flashbacks.
Dude, I know. I haven't thought about this in years.
The amount of crap we had to memorize that just is fake is
Yep.
astonishing.
How does that? So we can get more into the weeds about school because school is absolutely rubbish in those senses. I mean, I want to pause for just a second because I want to be fair. Learning the basic sciences, learning how
Yeah.
to differentially diagnose and rule out serious conditions, learning, because again, in order to get the rights as doctors to differentially diagnose, we have to have a general familiarity with basically every health condition on the planet, right? All the common ones, anyway, right?
Yeah.
And that was invaluable education.
Yeah. That was great.
All of that fantastic. So it's not that we are chiropractors who like are self-hating chiropractors and all chiropractors suck. We have a foundation that if we just built on that and then actually used evidence-based treatment, we could be set up right for
Yeah.
success. Because and this is one of the things. Now, sorry, I'm going to get a little ranty on this because I think this is really important.
Go for it.
um, Vitalism. Okay, so vitalism in chiropractic. So we basically there's a split. For you, those of you listening, you might not know this. This is why chiropractors get such a bad rap, is because there's a divide in the chiropractic profession where we don't even know who we are because one faction of the profession is stuck in the past. They're the vocal minority of vitalists who are their claim is that the body can heal itself, which I fully agree with but
Yeah.
not for the reasons they claim, right? Because they say, well, the body can heal itself, but in order to heal itself, we as chiropractors need to come in and have an external intervention to allow your body to heal itself, which
Yeah.
doesn't make sense to
Yeah.
me.
If your bones are out of alignment, the healing energy won't flow. So
Yeah,
if you
you won't
want
get.
your body to heal yourself, you need to come into my office. Let me crack your neck quick,
Yeah.
and then it'll heal itself.
And then we'll unleash the healing vibes.
Yeah. Yeah.
Yeah, we gotta. Oh my god, it's so stupid. So it's crazy to me, like the emphasis on that stuff. But here's the thing: is like, okay, and the reason I chose the profession in the first place because I could have gone in, medical, or I would have gone osteopathic, or I would have gone PT. And the reason why I chose to go chiropractic was because it had the most curriculum on lifestyle interventions, which is what I was interested in, right? Because my own journey was learning how taking care of myself, exercise, nutrition, what we now call the 4 pillars in our program: exercise, nutrition, mental health, and sleep. Those are the things that get you better, right? Like, sure, all the external interventions in the world can do something for some people for a short time. Nothing wrong with those things. But if you really want to change your life, you have to change your lifestyle, right?
Yep.
Consistently. So it's weird because like I feel like there's such good common ground where we could maybe get some of the vitalists, the people that are holding the profession back, and say, look, and bring them onto the evidence-based side and say, look, the evidence clearly shows that adjustments do not change joint positioning. Right. I just made a video talking about the SI joint, and one of the studies that I cited was showing that sacroiliac joint manipulation does not alter the sacroiliac joint position.
And
Right.
that would be like if you said that to the wrong room of chiropractors, they would be furious. Like you just insulted their grandma.
I know.
Like
Yeah, sure.
which is crazy. Like
It's stupid. This is oh my
yeah.
God. The amount of times I remember there was a certain um, very opinionated classmate that we had
Yeah. Yeah.
with dark hair, and if you remember the one,
Yeah.
but I remember one time after one of our class periods, she like marches. I mean, she just marched out, and was like, "Why are you even like in chiropractic school? You clearly don't believe in what we're doing here." And I was like, "Bro, chill. Okay, first of all, I literally just spent in that class, I just quoted actual peer-reviewed research, which is what you should be learning how to do because you're going to be a doctor,
Yeah. And
first
we
of
did
all.
learn that. We had classes on reading research.
Yeah, yeah, I don't know if you failed those classes,
Yeah.
but or just didn't attend or check them out or like, put
Yeah.
them in the dark spot in your memory banks and subconscious where you keep all of your pent-up aggression that's coming out right now. But whatever it is, we did learn how to read and critically analyze research on musculoskeletal topics specifically. So I don't know why this is shocking to you. But more importantly, just because I'm telling you that research clearly shows that we don't alter joint position and we don't put bones back into place and we're not breaking up scar tissue and adhesions when we do soft tissue therapies and basically all of the mechanisms that we think are happening are total bullshit.
Yeah.
But that doesn't mean there's no benefit to what we do, right? And we now, I'm just speaking general as chiropractors, right? Hands-on therapies have a time and a place, and they can be used in a way that is still evidence-based, right? There is an
Yeah, for sure.
evidence-based application for them, and it is short-term pain relief to use alongside lifestyle change.
Yeah, for sure. I mean, there's lots of chiropractors who adjust and like do hands-on therapy that are great. They're great. They're great like doctors, they help tons of people, and they either also do exercise or lifestyle intervention, or maybe they hate doing that, but then they hire somebody to do that. Like
Sure.
they like recognize that adjusting is a tool and not like God's gift to the world.
Yeah.
But yeah.
I totally. So what I'm saying is like it's so weird because I would think that if I sat down with somebody like that particular classmate of ours or any of the Vitalist chiropractors and I was like, look, how can we really? I agree. The body heals itself most of
Yeah.
the time, right? Fully agree. So how can we help the body to have the resources and energy to do that effectively? And the right stimulus to cause those types of positive adaptations that we want to see in the body,
Mm-hmm.
and particularly making your body as resilient as possible. And ultimately, it's like, well, duh, it's lifestyle, it's exercise, nutrition, mental health, sleep, and
Yeah.
all that.
Yeah. It feels like if you're trying to help the body heal itself, and that's that we all have the same goal. And it's like let's say you're trying to fill up this cup with water, and that's the body healing itself. It's like you have all these like nice transfer devices, these like a pail with no holes in it. So we can improve, like, this is mental health, this is exercise. Like, these are all these good things you could do. And then adjusting is like this little tiny cup that you could like
Yeah,
use to
it's like
fill
a
up.
teaspoon.
Yeah, it's
Yeah,
like, yeah, it can contribute. Like, I don't mind getting adjusted here or there, but like, it's such a small rock.
yep,
If we like, in the health world, you talk about focus on the big rocks first.
yep.
You have to move the rocks, do the big ones. Adjusting is it's such a small rock.
Yeah.
And then, people will be getting, we can talk about, when our clinical experience, but I mean, people who just aren't sleeping, they're clearly, they've got all the
Mhm.
signs of like being an alcoholic or like
Mhm.
whatever. And they're like, they go to the chiropractor and it's like, I'll just come in once a week and get adjusted. And
Yeah. Yeah, it's just laughably insane to have the amount of focus that we
yeah,
like in school that we did on adjusting, given the actual impact that lifestyle has on people, right?
yep,
I mean, if you really like, you're just thinking about it, and people are making videos online where they're like if you don't like you got to correct your posterior hip capsule extensibility
yeah.
because of your knee valgus and lack of dude Connor, I'm gonna throw him under the bus because he's a fucking idiot. I'm
It's
sorry.
funny. I haven't seen him before, so he's new to me.
Yeah, Connor Harris is he's a fucking idiot. So the problem is he's really smart,
Oh,
right?
sure.
He's really really smart
Yeah,
about like
sorry,
just
Mike.
the words
This
that
is
you
my troublemaking cat.
I know, like, where's my dog? It's
Yeah,
going to be show and tell time soon.
yeah,
Just don't get the wrong angle with the cat. You know how they like to do that.
I know. I grabbed her before she could.
Yeah, exactly. Be the star, oh no, of this show. Um, God. Anyway, what was I saying?
Connor Harris,
Yeah.
get
Yeah.
under the bus, Connor.
He's really smart, so he knows a lot of words,
Yeah,
which is great. But the problem is like every time I see a video of his, it's like, dude, is this really what you think causes chronic pain? Is this what
yeah,
you really think that is worth focusing on? And every single video, I'm sure he has some videos where he says some smart things because somebody commented on one of our videos and was like, well, actually, Connor kind of like also thinks that lifestyle is important. Oh, like, okay, cool. So one time he acknowledged that lifestyle kind of
yeah.
matters.
But you speak through your actions, right?
Yep.
That's like if somebody's, I don't know, saying terrible things all the time, but they're like, well, actually, I don't think that. It's like, well,
Your actions say otherwise, my
yeah,
friend. So
yeah,
if every video that you make is showing models of a loose, by the way, sacroiliac joint. If you've
yeah.
noticed, he uses this model where the sacroiliac joint is like held together by elastic bands.
Oh,
So
funny.
you can move it like
A bunch.
50 degrees, 60 degrees of
Yeah,
motion, when in reality, the SI joint only moves 1 to 3 degrees. It
yeah,
almost is fused. It almost doesn't move at all.
yeah.
So and then he's saying like, well, actually, if you tip and tilt and nutate and
And
counter
you're like,
nutate and
yeah,
internally and externally rotate, and you're like, your SI joint literally doesn't do that.
yeah. And you're using all these fan. I mean, this is actually really good to tie it back to issues in chiropractic. People get so far down these rabbit holes, and they get like, I'm so smart, and I know all these smart people things,
Uh-huh.
and like I know that I know all of the gliding motions of the low back or the ankle or whatever,
Sure.
and
Blake,
they
Dr. Blake, it's called
yeah.
arthrokinematics.
Oh, yeah, yeah, sorry. Um, and then they think that like the SI joint is the cure to everything.
Yep.
Like there are actual chiropractic techniques that think if you like put the SI joint back into place, it's
Yep.
gonna like fix like all your
Yep.
problems.
SOT.
Yeah.
Yep.
Yep. So like you get so hyper focused and like so I don't know, smart person syndrome or whatever.
Yep.
Or maybe it's like the sunk cost fallacy. I've put so much time into learning this stuff
Yep.
that it has to be the way. But like when we really just zoom out, it's simple stuff that like most people know they got to take care of their mental health. They got to eat good food, they got to sleep, they got to move. It doesn't matter if like your SI joint or like your ankle is whatever.
I think it's kind of a superiority complex, right?
Yeah.
You've got all the knowledge. I agree. It's kind of a sunk cost sort of superiority ego thing of like, I know all the things. And because this is specialized knowledge, this stuff is the stuff that matters. But
Yeah.
I think that you could take I mean, my favorite analogy for this, I was going to say you could take any field, any subject matter, and I think somebody who is a true expert on it, like a guitar player, right?
Yeah.
Like if you're learning how to play the guitar, how do we get somebody to be a guitar player? Do we teach them a bunch of fancy techniques and tapping techniques and thumping, which is like a thumb technique that like really advanced guitar players like or bass players like Victor Wooten use, or
Hmm.
these math metal guys are using? Are we going to teach them those techniques, or like playing all kinds of Spanish finger techniques and stuff like that? Those are very complicated. But if you make your whole personality that, and you never teach people like finger positioning on the fretboard or how to play a basic open chord
Yeah.
and bar chords. Oh, bar chords are for whatever. Like, yeah, okay, cool. You're a jazz musician that's, basically a virtuoso, but if you want to
Yeah.
learn to play the guitar, you got to learn your scales, you got to learn your chords, you got to learn the notes. That's what gets
Yeah.
you to be a guitar player.
And we at best gloss over that
Hmm.
in like it is kind of covered in chiropractic school a
Yep.
little bit, but it's like most of the profession just is like, yeah, like sleep is important, yeah, like nutrition, cool,
Yep.
whatever, but then we go to adjusting, or or they go down some other rabbit hole. Like chiropractors really like to go down rabbit holes.
Oh yeah.
Supplement like nutrition, yeah, whatever, but you gotta buy these $500 supplements.
Yep.
Or sleep, sure, but you need to like buy this super fancy mattress, and
Yep.
like we really like to overcomplicate it.
Yep.
And
Before, it's not like we know that and then we're using it after somebody's already exhausted their lifestyle changes. Like with sleep, it's like, okay, do you go to bed at the same time every night? Do you wake up at the same time every morning?
yeah,
Are you super active right before you go to bed, or do you have some kind of wind down routine? Let's start. Oh, and is the distance between your bedtime and your wake time enough total time?
yeah.
7 hours or more?
And do you drink a pot of coffee before
Yeah.
you go to bed?
Yeah. Yeah.
Like,
Like, can we start there? And then maybe implement some of those strategies for like a month. And if you're doing everything perfectly, then sure, let's talk about your mattress and sleep position and
yeah, that's
pillows and
fine.
arrangements. But it's, or with nutrition, again, it's like people are so concerned with the fucking oxalates in their spinach.
Yeah,
And meanwhile, they're eating, 4,000 calories a day of heavily processed, highly addictive, ultra palatable foods that don't
yep,
fill you up and don't make you feel satisfied and don't improve your health. Like,
yeah. We
it's
just,
insanity.
yeah. I mean, yeah. I think to summarize the issue that I have with chiropractic, it really is that they hyper fixate on all this little crap that matters maybe a tiny bit,
Mhm.
maybe, probably not, but maybe, and they ignore all these big things, and it's really frustrating. And to be like, um, I don't know what the right word is, but not be to be nice. Like it's probably a product of like the whole system. Like it's hard to get a job as a chiropractor. You get desperate. You can't pay rent. All of a sudden, you're selling supplements. You're like, oh, I can pay rent now.
Mhm.
But so there's like lots of issues. But
Well, and
yeah,
yeah, I mean, a lot of it. This is part of the problem too, is because we know a lot of other chiropractors who are still practicing hands-on, and they're working in clinics, and their hands are tied because
yeah,
they have no they have no alternative because especially if they take insurance, that's all insurance pays for.
yeah,
I mean, yeah, technically you can get reimbursed for a couple of other codes, but for the most part, it's like if you actually want to be able to keep the lights on in a clinic, you have to adjust. You have two options if you want to run a clinic, an in-person chiropractic clinic. One is to get as many people in the door, take insurance, and just get your whatever $50 a pop for cracking their back
yep,
and get them out of the door as fast as possible because literally the only way to make more money is to get more adjustments done in a day.
yeah.
That's it.
Because insurance doesn't pay well for other stuff. It's
Exactly.
yeah,
And well, exactly. Even if I did, because if and people might not realize this, but like for example, if I saw, I'm trying to remember back to when I was working in an insurance clinic. So this, for those of you listening, is going to be maybe a little bit, really revealing of what we, get paid from insurance, and it's insane. First of all, we're coming out of school with hundreds of thousands of dollars of student debt because it's a doctoral program. And then we're graduating into a profession where the public sees chiropractors as essentially a service, not a
yeah,
doctor, but as a service, right? Like, oh, just pop it right here, pop that right there for me. Okay, cool, done. Here's your money.
yeah,
And so because it's commoditized, it's just who can do it for cheaper because we're just like adjustment monkeys. Yeah, I don't know,
yeah,
like,
yeah, yeah.
right?
I mean,
So
that is what some chiropractors. That's what the profession is pushing people towards, and there's some people that are happy to do that, and some people that aren't.
well, school overemphasizes it, and
Yeah,
then insurance only pays for it, and the
yeah,
public expects it. So we got
yeah,
three problems, or probably more that I'm not thinking of, but three major problems with even if you want to do evidence-based practice, and it's not just chiropractic; it's every. I want to really emphasize this.
yeah,
Every single medical profession, everybody's like, we get a lot of people who don't trust doctors at all in general. It's not just chiropractors, it's physical therapists who are giving you cookie cutter bullshit and not paying attention to you. And you go in and they've got 10 patients at the same time. And they don't even, the doctor of physical therapy is not with you. They pawn off an intern on you and
Yeah.
they're not even paying attention because they're trying to track 10 other patients. Or medical doctors who rush you in and out in 5 minutes. And before they, even let you open your mouth to tell them what's really going on in your own words, they're
Yeah.
already filling out a script, and
Yeah.
for medication.
Yeah. I mean, I had a family member who has been having like blurry vision and had like some tingling in one side of her face.
Well, that's concerning.
Yeah, yeah. So she went in, and the doctor, before she said anything, basically was like, "Oh, you got to lose weight. Your BMI is high."
Oh, Jesus.
Like, so it is an
Can you
issue.
do an exam first?
Yeah, yeah. It's an issue
Oh,
in across the board.
yeah. But
I
why do you think that issue is? I would say it's just because insurance only pays you to do that, and your school
Yeah.
heavily emphasized one thing. So, like, medical
Yep.
doctors are going to get a disproportionate amount of training on pharmaceuticals,
Yep.
which, because of the sheer amount of training you get on a particular subject matter, you end up valuing it and doing it more.
Yeah. If most of the tools you own are hammers,
Yep.
everything is a nail.
Yep. Yeah, no matter what your profession is. Again, PTs, it's the same thing. Everything
Yep.
is a muscle imbalance. Everything is core stability.
Yep.
We teach
Yeah.
core stability in the beginning because it's a skill. It's one skill. It's like you should be able to move your hips. You should be able to brace your core sometimes, but you should be able to relax your core sometimes.
Yeah.
It's one skill.
Yeah, I think that's a big issue. I would also throw in there that if you're like a lot of these places are businesses and it's harder to market an actual nuanced solution
Mm.
where you're like, oh, we're going to do this and this and this and this. And if this doesn't work, maybe we'll do this. It's way easier to market. Like your core is weak.
Why?
I don't know.
You know what I mean? Because I would,
Yeah.
from my perspective, I mean, obviously I own, this business, and so I have to be aware of how to market and present the ideas of what we do in a way that effectively communicates why this is the solution.
Yeah.
And it's not just because of research, because we got to take thousands of pieces of research that we've analyzed and be able to distill that down and make it understandable for the average person. And for me, I think it's very easy to explain and frankly market, because it's like,
Hmm.
look, the only way you're going to be able to be healthy for the rest of your life is if you learn how to take care of yourself.
Yeah.
That seems pretty obvious to me.
I think it come getting a little philosophical, but I think it comes at like people, if they have a problem, they like the answer to be simple
Mhm.
and not something that is going to be difficult.
Yeah, yeah. So
So,
you want it easy and you want it now.
yeah, so like tell me that I can just get my back cracked. I don't need to start exercising. I don't need to fix my sleep. I don't need to change my diet. I don't need to give up anything or do any like difficult life-changing stuff because like changing your life is hard,
Mhm.
right? Go like, am I going to do 6 months of rehab or am I going to go get a knee surgery? Right? It's kind of the same across the board. Right?
Yeah. Yeah. I think you're right. I think it's also, yes, it's the effort required, and the cost of effort seems higher to most people than the cost of a lifetime of pain, even, because we're
Yeah.
really bad at delayed gratification, right? We like we can't, I don't know, envision what consequences are going to happen later. I mean, this is why most people suck at taking care of themselves, because heart disease, right? Diabetes, stroke, right? All these things, dementia, Alzheimer's, not that everything that I named is 100% preventable, but you can really reduce your risk of basically everything if you live a healthy lifestyle. But they're
Yeah.
slow. They take decades to happen. And this is the same thing, just a sidebar here with the carnivore diet, where people are like, oh, I feel amazing because I went on carnivore. But, no, my heart feels amazing. Dude, heart disease is a decades long thing. You don't feel heart disease
Yeah.
happening. That's you just a lack of understanding of how disease processes work.
I think the carnivore diet is actually a really good analog to chiropractic. Like it's
Okay,
kind of similar.
let's
So
hear it.
like, well, okay, both of them, at least with chiropractic, I'm talking about the more vitalistic side that you were talking about
Yeah, yeah, the
earlier, right?
philosophy-based
Yeah,
chiropractors.
like we're just gonna adjust. That's really all we're gonna do. Maybe a little bit of extra stuff, and it's we're gonna unleash your innate intelligence and blah blah blah. Um, so the carnivore diet presents a alternative kind of edgy solution when compared to like traditional medicine. They're like,
Sure.
traditional medicine is wrong. You thought that fruits and vegetables were healthy for you. That's all, that's all crap. Um, what you actually got to do is eat the carnivore diet because, your ancestors own, they were carnivores and they ate the whole animal, and you just need to do that, and then you'll be really healthy. So it's presenting a single solution to all your problems.
Yep.
It's really flashy.
Hmm.
It's like the traditional approach is wrong, and then it makes sense if you don't know enough.
Hmm.
Because the truth is, like we've never been carnivores. Like we've
Yeah, well,
always
you've
been.
got a bit of a hobby
Yeah, I got a
fascination with.
pet. Yeah, I got a pet interest in like ancient human cultures. We eat anything that we can eat. Like that's our thing.
Would you say that's maybe like the reason we became the dominant species on the planet is because we're so adaptable?
Yeah, we're really good at eating different things and living in different environments. And the when we look at cultures, the ones that live up by the North Pole, they eat way more animal fat and meat because that's mostly what's up there. The ones that live near the
Yeah, it's not
equator,
by choice.
yeah, they eat way more plants because there's a bunch of plants in the Amazon rainforest.
Yeah.
Like, but so like the point is, but it sounds right. People think they're like, oh yeah, like we were cavemen and we like
Yeah, yeah.
ate mammoths, and so it sounds right. And then it's also a cult. Like it becomes a cult.
Yeah.
Chiropractic is kind of like that too. You They're like, oh, when you hurt yourself, it kind of feels like something's out of place. Like
Sure.
something's like stuck.
Well, and then somebody hands you,
Yep.
grooms you almost with, I mean, it kind of feels like that.
Kind of, yeah.
You know what I mean? Like
Yeah.
your healthcare practitioners are kind of grooming you with the language to use,
Yep.
so that you can basically just agree with them. They're trying to make it easy for you to have a way to describe your symptoms. And that's what
Hmm.
people want. They want to feel like they know what's going on because it
Yep.
makes them feel more in control, because having pain and injury is a big unknown, and
Yep.
it's terrifying to not know what's coming up next. So if you feel like you know, even though the explanation you were given was absolute nonsense,
Yep.
it still feels better to have the explanation than to have uncertainty. But the
Yes.
reality of chronic pain is it is nothing but uncertainty. And that sucks. But so how can we give somebody certainty even while acknowledging the complexity and uncertainty of chronic pain? And
Right.
that is to say, well, we do know this. We
Yep.
don't know how much better you can get, but we do know that almost every single person has aspects of their lifestyle that they could
Yep.
improve upon. And not like by making health and wellness your whole personality, but by
Yep.
just doing basic stuff. And if you
Yep.
do that, we know that your risk
Hmm.
of continuing to have chronic pain or re-injury or really any health condition on the planet, like if you want a one size fits all solution, it's lifestyle.
Yeah.
Of course, then you have to say, well, actually, it's not one size fits all because you have to fit the lifestyle of the person. But if
Yeah.
you want a one answer that fixes basically everything, it's lifestyle.
Yeah. Live a healthier lifestyle. Manage your stress, like mental health, sleep, nutrition,
Yeah.
movement.
Yeah, it's not complicated.
Yeah.
So anyway, if we can get people to just do those things, then we know that it can at least improve your situation. Even, and I mean, and this is the worst case scenario that we've seen working with patients. I mean, well, technically, the worst case scenario is somebody has an underlying serious disease that
Yeah.
was undiagnosed. That's the worst case scenario, right?
Yep.
And that's why we always emphasize, even though all the education on our channel is like, stop worrying about your disc herniation. Don't worry about your MRI. Don't freak out about your arthritis, your nerve stuff, whatever. Like that stuff probably doesn't matter. And we even, encourage most people not to get MRIs unless there are red flag symptoms, or unless their doctor thinks that it's important to do so.
Yep.
Because you're 12 times more likely to get surgery if you do get an early and unnecessary MRI.
Yeah, you kind of get thrown into the hot, like the conveyor belt.
Hmm.
It's
But I am a fan of saying, hey, if you think there might be something going on, get it checked out.
yeah, it doesn't hurt.
100% get it checked out. Anything you feel like you want to do so that you've got the peace of mind. If you want to order all the tests in the world, yeah, it does increase your risk of pathologizing normal and freaking out about things that don't matter and being disabled due to fear. And, medical fear is more disabling than the pain itself and all that kind of stuff. But if you need that peace of mind to really rule out serious conditions, we're talking fractures, tumors, infections, cauda
Yeah.
equina, that type of stuff, Mets, like there are a lot of serious things. Do everything you feel like you need to do. But once you feel like you've covered all your bases, and it's normal stuff like disc herniations, bulges, etc., cartilage issues, joint issues, muscle issues, bone, as long as it's not like I said, metastatic cancer in your bones, and it's just like I've lost my bone density a little. Well, then focus on the things you can control,
Yeah,
right?
it's all lifestyle at that point.
Yep, that's it. And even if, and this is what I was going to say, is then as long as we've ruled out red flags, then really for most people, the worst case scenario is you continue to have pain, but your ability to do things that you love and enjoy in your life improves. Meaning,
Yeah.
same pain, way better life.
Yep. You focus on function. And a lot of times when people start focusing on function and just living their life again and improving their life,
Yeah.
improving your sleep, going to see your friends and family more, eating good food, like enjoying life, the pain starts to go away.
Yeah.
Right? But when we get so hyper fixated on fix this pain, fix this pain, fix this pain, it tends to kind of get stuck. People
Yep.
tend to spin their wheels.
Yeah. What you're paying attention to gets magnified.
Yeah.
Yep. Yeah. 100%. Um, well, okay. So one thing we haven't talked about so far is, like why, what's the difference really between we've kind of talked about what hands-on treatment does or does not do. We've kind of myth busted some of that stuff. And we've talked about obviously the importance of lifestyle, but for you, like what was clinical practice like?
Yeah.
What was it like treating people in person? And why do you not do that anymore?
Yeah. So my clinical experience in person was a combination of working at like a chiropractic chain, right? So they I think they're kind of all over the U.S.
Mhm.
But basically, all it was adjusting, right? In and out. They wanted you to basically have 5-minute appointments. The new patient stuff was maybe I think they booked out 30 minutes for a new patient visit, which
Yeah.
isn't terrible. But so is that, and then I had my own clinic at the same time, seeing patients. So
And by the way, I just want to say I think that particular establishment liked the 30-minute appointments for new patients, not because they actually wanted you to use that for
no,
treatment and a thorough exam, but because it was a sales pitch
they
to get
wanted you
you
to
on a
sell.
recurring membership.
Yeah. So I can start with talking about the chain I was at. So I was afloat. So I kind of I wasn't like the doctor at any one location, which shielded me from a lot of that because it wasn't my job to sell because it didn't benefit me.
Yep.
But then occasionally I would work with another doc who's like the head, I'd be the second doc, and they would talk about, like, well, hitting these quotas and getting bonuses. And
Mm-hmm.
I'd walk into the break room, and on the lunch or on the whiteboard, it would say like, you know, 20 new patients this month,
Mm-hmm.
or, they'd have a trophy that's like, congratulations on being the location that got the most new patients this month.
Mm-hmm.
And from like a business perspective, obviously, like gamifying it and incentivizing it, it makes sense, but it's terrible for patients.
Yep.
It's terrible. I mean, I can't tell you the number of times I listened to a front desk person talking to a patient who wanted to cancel their like subscription,
Mm-hmm.
only to say, well, you committed to 3 months. You signed the contract. We
Mm-hmm.
said it was a 3 month commitment, which, by the way, I'm pretty sure is illegal at least in Minnesota where I'm at.
Oh,
Like, I think you have to give people a refund on, but
it's probably different with in-person treatment.
yeah.
There's certain laws that apply to the doctor-patient relationship that's established within your state.
Yep.
Where you have like duty and all that kind of stuff. So, yeah,
But,
it was
yeah.
scammy.
My point is they were selling visits ahead of time in packages.
Oh no, definitely. If you have actual
Yeah.
in-person visits that are
Yeah.
unused,
So it was
then
like, we're going to
yeah.
sell you 4 visits a month for 3 months.
Yep.
And people would come in and be like,
Yep.
I actually only needed 4 visits.
Right.
So I feel really good after a month.
Yep.
Right? And then they would be like, well, but you paid for these visits already.
Got it. Yeah.
And
So
then they would give them the runaround of, you need to talk to my boss, but my boss isn't here. And it's not the front desk person's fault. They hire like college students and
yeah. And they're just doing what they were trained on.
They're just doing what they're trained on. It's just this whole system was just bad.
Yep. What about the actual treatment though? So obviously there's some chiropractic businesses that give us all a bad reputation, and that sucks. But what about the actual treatment?
At that clinic, it was just adjusting.
But like, why don't you do it anymore? What, like you've worked at some different places. Why don't you do that anymore?
So, like I said, there was just adjusting. At my clinic, I tried to do more. I tried to like do exercise and, education and whatnot. But the issue is that I think the crux was that people come to the chiropractor in person with the expectation that they want to get their neck cracked or they want to get their back cracked. They don't want you to talk to them about anything else.
Yeah.
Really. I mean,
like,
and even like the clients that I give exercises to at my clinic, and some of them did them and their life was changed. But most of the time, they didn't really do it.
Yeah.
Right. And the issue is, you might say like, well, why don't you do the exercises with them? It's like, well, then I'm going to have to bill them for an hour, and that's really expensive, for the patient. So I found that, the online space kind of gets rid of that, like, because obviously we can't touch them, right? Which I think is a blessing, because then all the conversations are around lifestyle change, because you're the one who has to do it.
It has to.
Right?
The only way
to do it.
Yeah.
So it's like, I remember at a certain point, which is sad, but it happens. At first when I was working with clients, and especially at the joint, I would like try to explain to them that like, no, you got to just like move, and like, you don't need to be afraid of your body.
Yep.
But after like the 100th person who's like, yeah, whatever, and then you never see them again.
Yeah.
It starts to
it's discouraging.
It starts to wear you down.
Yeah.
But with the clients we work with, that's what they expect.
Yep.
So they, ask a question about like, oh, what do I do with I tweaked my back today. Let's just give you like a really concrete example. If I was in person, it would just be, I'll crack your back. Oh, you should like do some stretches maybe. Here's some stretches for you.
Yep.
They might do them. Move on with their day. in an online setting that's based around education, it's like, let me teach you how to manage this on your own. Like, I don't think I ever felt, with the exception of maybe one or two people, that I made a lifelong impact on a patient. And I tried, but like, you don't have enough touch points. You don't see them
Mhm.
often enough. And if you do see them often enough, it's you kind of feel bad because you're like, well, you're coming in to get adjusted and it's not really that
Well, you're
useful.
creating that, yeah, because you
Yeah, you're
feel bad
creating
because you're creating it.
dependency.
Yeah, exactly. You want to
So,
be able to set them up to be able to take care of themselves, but because of the model and the
yep,
expectation,
they get
can't do it.
dependent on you.
Yeah.
Um, and whereas with like, the way that we see clients online, they get constant chat support. So it's like you can kind of walk with them for a certain amount of time through
Mhm.
this problem. And it honestly feels really similar to when I teach like anatomy and classes at universities. It's like this is a skill we're trying to learn. We are trying to learn how to manage pain for the rest of your life. Like in anatomy class, you're trying to learn the basic anatomy of the human body. And it's not my job to do it for you.
Mhm.
You have to study in school, you have to watch the educational content, you have to try to, practice the tools we give you, but they can, reach out as often as needed for help.
Yep.
Right. And then you guide them. So it's kind of like
And you're
chiropractic.
great. If we're going to use the school analogy too, the grade that you get at the end of the class is dependent on the effort that you put in and your consistent
Yep.
work during the process. And
Yeah.
we see that directly, right? We've got people that are,
Yeah.
very, they're in constant communication with us
Yep.
and they need a lot of handholding. But most of the time, the people who are, I mean, you tell me, because now,
Yeah.
you're handling a lot of the daily questions in our program, at least right now. I'm always on our video calls that we do, multiple times per week.
Yep.
But then, our clients get daily chat support as well, and they can ask you questions anytime. And by the
Hmm.
way, like you get compliments constantly from people about
Oh, that's nice.
I'm passing
Yeah.
this on because like
Yeah.
on our graduation calls when we get to the end of the program, they're like, Dr. Blake is amazing, like he's always responding. Like, I remember one person was like, it was like a Sunday night and he like got back to me in 30 minutes and I was like
It works for my brain. I can't, the idea of sitting in a cubicle or like a job or a 9 to 5, like when I was at this chiropractic chain, needing to be somewhere for like 9 hours, I
I get it.
it
I hate
drove me
that.
crazy. The
Why
like,
do you think I started a business?
yeah, the messages coming in, like even if it's more work throughout the week, it doesn't bug me.
Yeah.
So it fits nicely.
Yeah.
But yes, the clients who communicate the most get the best results. And usually those results come in the form of like better improvement in symptoms, usually. But sometimes they're like, well, my symptoms are improved a little bit, but I feel so much more confident in my ability to do this on my own.
Yep.
That's the big thing, because like, I mean, truthfully, like obviously we would love it if everybody had zero pain at the end
Of
of
course.
the 3 months. But if you've had chronic pain for 10 years, like it'll probably take more than 3 months
Yep.
statistically. But if you know how to do it on your own at the end, that sets you up for the rest of your life,
Yeah.
right? So the people that communicate is a lot, especially that happens.
Yep.
So which is really, really cool to see. The most fulfilled I've ever been seeing, working with, like I was a personal trainer for a while. I saw patients for a while, and then this is by far the best.
Yeah, the lifelong changes
Yeah.
I think are huge, and again, people, the thanks and appreciation that we get on our graduation calls from people who've been through our program, and appreciation for you for the program we've set up for really just getting them over. I mean, there's so much fear. There's so much
Yeah.
fear when you're coming
And,
in with chronic pain,
yeah. And I
and
think
uncertainty.
to loop it back to clinical experience, and you probably had this too. Um, with my clinic, I tried not to do this, but when I worked at this chain, it's pretty fear based. You know,
Yeah.
all the scripts they give you to like to sell
Hmm.
people. And this one wasn't even like particular. Like I've heard way worse.
Hmm.
Like I would say the place that I worked was kind of middle of the road. But you know, you tell people that like you know, you're this is out of alignment
Hmm.
and you need to come back. Like we want you to come in 3 times a week for 4 weeks and then 2 times for X. And like that's such a fragile way of explaining stuff to people. It's
Hmm.
like your body is so jacked up that you need to come and see me, whatever, 25 times in the
Hmm.
next 3 months to like realign your spine because your spine is out of place right
Yeah.
now. Like,
Yeah,
what are
it's
we even?
scary. That's
That,
scary to
that
hear.
that's terrifying.
Well, and even again, to make sure that people understand this is not a chiropractic specific problem. It's personal trainers, it's
Yep.
physical therapists, even the people who are really exercise focused, right? We look
Yep.
at physical therapists and they're saying the same stupid shit, and personal trainers like,
Yep.
if your knees go over your toes, your knees are going to explode. If you round your back while you're deadlifting, you're going to splatter your discs. And they're using words like splatter. You're like,
Yep.
God. First of all, have you ever even dissected a human body? Because if you did, you would understand that the actual discs are these tough, rubbery, like
Yep.
they're like hockey pucks. You know what I mean?
Yeah.
They're not, they can't splatter. That's literally impossible. They're
They're
too
like,
tough.
yeah.
So
Yep.
first of all, no. Second of all, no. Third of all, no. But it's
Yeah.
like now because they're saying, well, if you don't, oh, and also we have tons of studies on this. And if anybody's listening or watching this, just comment. I'll send you the stuff. But we've got videos breaking this down. Your they're looking at like kettlebell swings and observing like with the naked eye. And even when we look at a spine during a kettlebell swing and we look at them and we say, yeah, that's straight. They kept their spine straight. But then they actually put
Hmm.
position sensors on the spine. We see no, actually they were in 30 degrees, 30 to
Yeah.
40 degrees of spinal flexion. But the naked eye, when we're looking at them, and these are trained, these are not just like random observers, these are trained professionals watching them do a kettlebell swing and trying to judge, are you keeping a neutral spine or not? And
Yep.
even professionals saying, yep, that's neutral. Nope, bro, that's
Not
30
neutral.
to 40 degrees of bending.
Yeah.
So it's
So,
literally impossible to not bend your spine. But then ultimately, then the patients develop these fears, and then of course they're scared shitless of doing anything that's not perfect. So then because the number one problem that we have with people with exercise with chronic pain is you either do too much too fast or you do too little for too long.
yep.
That's it. Those are the only two options. And most people, they've already tried too much too fast, and because they have injured themselves or flared things up by doing something their body wasn't ready for yet, now they're understandably freaked out about movement because they're like, I
Hmm.
do not want to have another day where I am laid out on the floor and literally can't get up again. Maybe I was home alone and I had to wait until my husband got home to help me get up and get to the emergency room. I never want to go through that ever again. And so, of course, they're squeamish, they're cautious, they're very cautious around, well, I don't know about these cat cows. What if I end up in the emergency room from doing a pelvic tilt? And you're like,
Hmm.
whoa, like that's a lot of fear.
Yep. There's so much. There's so much fear in chronic pain, and I think chiropractors are one of the worst offenders. But I think PTs do it, MDs do it, etc. But we feed it. Like we feed this fear with all these like let me just pick on each profession, chiropractic, your spine's out of alignment, or your pelvic, and then PTs, you'll go to a PT and they'll be like, oh, you have anterior pelvic tilt, or you have muscle asymmetries. You go to an MD, they'll take an MRI or an X-ray or whatever, and they'll see on the MRI, oh, you have 3 disc
Oh
bulges.
my God, you've got the spine of an 80-year-old.
Yeah, yeah, they
You're
won't
like,
tell you
dude,
that that's
chill.
normal for your age.
Yep.
That if you're 50% of 50-year-olds with no pain are
Yep.
going to have disc bulges. So
60, add 10.
is it 60?
Yeah, yeah. So just take
Yeah.
your age, add 10. Yeah.
It's crazy. So like what happens is you walk into, any one of these people and you're like, I have back pain. I'm coming to this person to fix my back pain or sciatica or whatever. You have one, let's say you have one problem going in and you come out with like five problems.
Oh
You
yeah.
came in with back pain and it's
And
like,
now you got an anterior
I've
pelvic
got
tilt
anterior
and a
pelvic
foot
tilt and
pronation and your joints are out of place and you got your
yeah,
muscle imbalances and a weak core.
yeah.
Yeah.
You're like, I came to this person to help me and now I have
I
all these
feel
other
worse.
problems and now I'm scared
Yep.
and
And weirdly, conveniently, they're the only person who can help me fix these
yeah,
maintenance issues.
they're always the only person that can
Uh-huh.
help you fix it.
Yeah, it's crazy the fear mongering. And I just wanted to add one more on top of that. I had a patient who had had a microdiscectomy, and he came to us after his microdiscectomy, and he told his surgeon, who he told me, it's weird. Every single patient I've ever had has had the best surgeon in the state. You ever get that feeling?
Yeah, yeah,
But seriously, so he was like, no, no, like I did all the research and this is the best surgeon in the state. I'm like, okay, cool. I was like, cool.
cool,
Like,
great,
so what'd they tell you? What did they tell you in terms of restriction? Because
yeah,
I'm trying to default to the person who did the surgery and say, like,
yeah.
look,
They
if
should
they
be the
told you
expert.
not to do something, we're not going to do it because we're not going to risk it.
Yeah,
And he's like, well, he told me, don't, definitely don't bend, don't lift, don't twist. And don't, he said, no planks, no core exercises, no planks. And I was like, do you just mean like immediately after surgery? And he's like, he told me I should never be doing planks, that planks are just too dangerous for my spine after a
uh,
microdiscectomy. I'm like, ever? Like
yeah,
in a year?
yeah.
He's like, he said never do planks, that they're bad because it creates too much pressure on the disc. And I was like, okay. At this point,
It's
we've lost, reality. We've got just
yeah.
completely lost touch with reality.
I sound like an old person, um, but it's like, dude, we're wimpy. Look at what we used to
Yeah.
like. Like we were like hunting mammoths, and then you're like, I'm in a farm for 12 hours a day. Like my grandpa's 83 and I mean, he's kind of sideways, but like, dude, he still farms. Like
Yeah.
just
I
this way
agree.
of looking at the body. The body's not that fragile. Like think about the things people do. If your body was that fragile, like everybody would be debilitated.
On a practical note, we've got Usain Bolt, fastest man alive, and he has a wicked scoliosis. We've got Paralympic athletes that are
Hmm.
completely missing a leg, one leg too, so they're super asymmetrical, and they're, higher level athletes than most of us could ever aspire to be.
Yeah.
And, on and on and on. But from
LeBron
a,
James's feet or one of the basketball players' feet are like like they look like this
oh, weird,
like their toes are
super weird.
the opposite of what all of like the feet people say that
Yeah, 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 yeah.
your toes should be able to spread out. The point is everyone's body looks different
Yep.
and we're not
Yeah.
that fragile.
Yeah, I think, and maybe this is a topic for another time, but I think we need a touch of Stoicism in and Buddhist philosophy to be, sorry if anybody doesn't like Eastern philosophy, but Buddhist philosophy and Stoicism have a lot in common, which is essentially the idea that we derive our peace not from whether we're having pleasure or pain, but from something deeper. And I'm not going to get into philosophy, but I think that, not attaching your sense of well-being to the highs and lows of your life, the pleasures and the pains, because you're going to have some pleasure and you can't always control when or how much, and you're going to have some pain at some point and you can't control when or how much. And if your happiness and your peace of mind and your quality of life is dependent on the highs and the lows, then you're going to suffer more. And we know that if you're suffering more as a result of those sort of self-inflicted attachment and aversion related suffering, then we know that just being in a negative mood essentially makes it more likely that you're actually going to suffer more. So if you want to avoid the negative, if you were trying to avoid pain. Trying to avoid pain brings more pain.
Yeah.
So,
Yeah. It's kind of, yeah. I mean, my experience with that was bashing my head against the wall because I'm like, I need to, like, I need to lift this certain amount of weight because of reasons. And, it's just self inflicted suffering at that point because you're like, I'm addicted to the high of lifting more
sure.
weight, but I'm also really averse to this pain. And I'm so frustrated that I'm
Mhm.
having this pain and also not having this high.
Mhm.
And and eventually I had to just be like, look, maybe I'm just not going to deadlift for like 6 months and I'm going to rehab my back and I'm going to be okay. My life won't end.
Yep.
I can find meaning that's not picking up a heavy barbell,
Mhm.
which sounds goofy, but like, I mean, we attach meaning to like a lot of things that frankly just don't matter that much.
Yeah. Well, that's yeah, I'm 100%. Well, I think this is a good place
We,
to let's go ahead and call it
we
for
put a bow
today.
on it of attaching meaning to things that don't matter, with chiropractors attaching meaning to subluxations
That
and spinal misalignment.
really don't matter.
That
Yeah. So I think the most important things for people to understand and biggest takeaways I think from this episode are stop sweating the small stuff, focus on the
Mhm.
fundamentals. The only way for you to improve your life is to put in consistent effort over time in the right direction and at the right pace. And it's going to be a slow and steady build, and you're still going to have some ups and downs. It's not going to happen overnight, but it will happen if
Yep.
you stay consistent. That's the thing,
Yep.
right? So, perfect. Well, if anybody is interested in working with us, we always put the link to our masterclass. So if you want to deep dive on, myth busting and know a little bit more about what we do and see case examples, then just find that, sign up for the masterclass. It's totally free. Watch that. And then if you want to talk to us, you can always send me an message on Instagram, or you can book a call after you watch the masterclass. Thank you guys for joining us, and we will see you on another episode.